All right, Johnny, we wanted to have a conversation here. I heard that you had a ton of questions.
I do, yeah.
About obesity and all those other
Yeah.
topics.
I'm always asking, well, as you know, my wife works at Forte, she's
Yep.
a PA there, and I'm always asking her questions about obesity, because I know you guys have an obesity medicine practice there, right? Is that what it's called?
Yep.
So I'm always inquiring with her, all these new medicines are out. We've always been really into physical fitness and trying to eat right. So that's the other side of the coin here, is I'm curious about how these medicines play into that.
Okay.
And then there's the public policy side of it. I've always been super interested in public policy. I majored in it in college. So we talk about healthcare and insurance and all that stuff. Obviously, it's a huge part of that. So yeah, a lot of questions.
Okay, cool. Let's tell everybody what your background is. So
Yeah.
you're a police officer.
Yes.
You're out there, you've seen a bunch of stuff, interacting with a
Yeah.
bunch of people.
Yeah, I like to think I can kind of cut through the proverbial feces, if you will. I don't know if I don't want to use a bad word.
Okay.
So yeah.
Yeah. So tell me what kind of stuff you're seeing and like where these questions have come from.
Yeah, really, I think, like I said, I've always been super interested in public policy and how kind of we can make decisions as a society that better everybody, right? Whether it's from the perspective of healthcare or the perspective of infrastructure, you name it, you know. And obviously, you know, keeping people healthy and keeping the country healthy and society healthy is a huge thing. And correct me if I'm wrong, but obesity is a risk factor in many, many different illnesses, right?
For sure.
So I guess that's kind of where I'm coming from. And I guess my first question would be, the medicines that we're prescribing people, are they like, do they help people? How do I word this correctly? The things that obesity is linked to, like diabetes and Alzheimer's disease, right, and heart disease and all these things. Do those medicines help reduce the risk factors for those things?
Yeah.
Okay.
Really quick, just so everybody knows, we haven't even talked about what your questions are, so we're just going to go totally off the cuff
Right.
here,
Yes.
right?
Yeah.
Okay. So, okay, the medicines, and lots of people wonder too about the lifestyle versus the medicine too. So let's chat about that just a little bit. So, do the medicines actually reduce the complications of disease?
Yes.
Is that what you're asking?
Yeah. So, like, for example, like I was listening to the radio, I think it was yesterday or the day before yesterday, and I guess there's a big study that came out of Texas saying that a GLP-1 will reduce your risk of colon cancer, like pretty drastically.
Yep.
And the discussion I had with my wife was, okay, is the GLP-1 reducing the risk of the colon cancer, or is it the GLP-1 is making your lifestyle healthier, which in turn is reducing your risk of colon cancer, right? So I guess to kind of, get down into the nitty gritty of it, that's the sort of thing I'm talking about here, and that's the question that I had for her.
So like big picture, obesity is known to cause over 200 complications, medical complications. So we're talking about the well-known stuff like diabetes, high blood pressure, sleep apnea, fatty liver with liver damage, one of the most common causes and needs for liver transplantation. A ton of downstream medical conditions. You mentioned cancer, and cancer's on the list. So there's 13 cancers that are considered to be obesity-related cancers. A lot of them are hormonally mediated, and so
What does that mean?
Like breast cancer is related to estrogen and other hormones. Ovarian cancer, uterine cancer, sometimes kidney cancer, liver. A lot of those are related to either the sex hormones or the metabolic hormones, insulin and some other things. So we know that obesity is related to those complications and directly causes them in a lot of cases. But some of them we don't have a direct link, we just have this association.
Like the causation versus correlation thing?
Yeah. So there's a lot of correlation, and there's some of them is causative. One of the strongest downstream problems with obesity is diabetes. So in people with obesity, there's a much higher risk of people progressing into diabetes. And there's a great study that shows treatment with one of the medications reduced the progression to diabetes by 94%.
Okay. So is that because their lifestyle is changing, or is that because the medication is having some direct impact on their body? Or do we not know?
Well, this one was actually a treatment study, and so they were actually doing lifestyle and lifestyle counseling.
Oh, so no medication.
On the placebo group.
Oh.
And no medication, and then the same plus the medication in the treatment group.
Okay.
And we've seen for years that people progress from pre-diabetes to diabetes almost consistently. And I mean, it's super cool to reduce the amount of diabetes by 94%.
Right.
That's awesome. There was an Alzheimer's study. People with Alzheimer's were treated with the medications. It actually failed. So we don't know exactly why, but we think that Alzheimer's disease or dementia types are related to the metabolic issues. But once they develop that, it's not like direct treatment.
They're past the point of no return.
Yeah. Well, I don't know. I mean, you don't really know, but it's not, it didn't help dementia as a direct treatment.
Okay. But it might help long term.
But what if you started at 10 or 15 years
Right.
before?
Yeah.
Because you know that there's some correlation between obesity and dementia.
Yeah. So here's a question. If there's so many positive downstream effects of the medicine, one thing that I've always wondered is if, like, let's say I'm the CEO of an insurance company, right? And I'm paying out hundreds of millions of dollars or whatever for diabetes and Alzheimer's and heart disease and all these
Billions
things.
or trillions of dollars.
Yeah, like so much money. Wouldn't I want, they make it so hard for people to get the medication. Jasmine tells me about this, right? Like, well, you're not approved for it. You got to go through this process. You got to pay out of pocket. Like, wouldn't the CEOs of these insurance companies be like, yes, please take this medicine. This is an investment for us up front, so we don't have these back end costs. Why don't they do that?
So this one's going to be hard to talk through without exact numbers. They'll do my best, and maybe we could post some numbers later. But the Arizona Obesity Organization is actually doing a paper right now on the cost effectiveness and the outcomes and benefits of medical treatment.
Okay.
So in Arizona, with the Medicaid plan, they've seen that patients with obesity and diabetes cost 3 times more than people without. So it was about $8,000 a year for people without obesity or diabetes, and about $25,000 a year with people with both of those. And there's another study, I'll have to cite this, but this doctor named Jamie Almondaz, I don't know if I said that right, who was on the paper, and it showed also the cost effectiveness of people without obesity or people with obesity, and the cost of their insurance, or the cost to the insurance company for their coverage was 3 or 4 times more than it would have been if they didn't have obesity.
3 or 4 times.
Yeah. Those are rough numbers. I have the paper. I can post a link on the podcast. But it cost insurance companies a ton more. But here's the problem too, though. The cost of these medications currently is high, and it has been high too. That's coming down, but if you use the current costs and you look and see how long it takes to get to a point of saving money, it's at least 5 years.
Okay.
So they're putting out more money initially without the return. Financially, it doesn't make sense.
Because they have to do their quarterly reports to their stockholders. And
they're gonna post a loss initially. And then they also say They have, what's the word for it? Migration. They have patients leaving their plans. And so they pay this 2 or 3 years, or maybe they pay in for 5 years, and they treat these patients, and then those patients go to another plan. And that plan realizes the benefit, because now they cost 3 times less than they did for the other plan. So it's tricky.
Right.
But now costs are going to start coming down. Medicare just negotiated prices for lower costs. And so now the cost of the medication is going to be $245 for the injections, for the cost to insurance, and then the copay to patients is going to be $50, which is, for Medicare patients, way lower than it has been.
Right.
So at the $245, we've been doing some analysis with that number, and it's still going to cost more than it would have not to do treatment, but it's much, much quicker to get to a
return
net
on
zero.
investment. Yeah. Okay.
And the other thing is, if the cost of the medications come down for obesity, they're also coming down for diabetes.
Oh, because it's the same medicine?
Yeah.
Okay.
Well, the same class, and so they're negotiating prices for the whole class.
Okay.
And so you have savings for diabetes and a little bit more cost for obesity. And in Trump's announcement last November,
That's what I was going to ask. Is that the same thing?
They said that they were actually net zero as they saved costs on diabetes and they increased costs to obesity. They were like finding the money from the diabetes savings.
Okay.
And we've found that with the Medicaid calculations that we're doing right now.
Okay. That's interesting. Another question. Sorry, I've got them lined up back here.
Do it.
Another thing that I was talking with my wife about, because we bounce ideas off each other all the time. So this is more a question of obesity and, like, I guess, body positivity and lifestyle. So if I'm, let's say right now I'm overweight. Let's say I'm 5'11", 300 pounds, right? And then I start eating healthy and excuse me. I start eating healthy and exercising, and I do that for a couple years, and I'm doing everything right, and I get to the point where, let's say now I'm 5'11", 220 pounds, right? So my BMI is still overweight, but I'm doing everything right, my labs look great, and my body has just said, like, no, we're gonna keep you at 220 pounds, and everything's cool, and this is just, like, this is your body type, and that's where you're gonna be at. Is that okay? Right? Because, like, if you look at the BMI chart, well, I'm still overweight, but I'm doing everything right. So is this just how I am? And do I need to continue to lose weight, or can I just sit at that 220 and be happy and healthy?
Oh, there's so many points there. Let me jump into a couple. So let's say you lose 90 pounds off of 300. That's 30% of your body weight.
Yeah.
So there's actually a ton of studies on lifestyle interventions and body weight loss. And I tell my patients, to be healthy, you have to eat right, you have to exercise. But the bad news is that often doesn't lead to weight loss. So whoever can lose 30% of their body weight with lifestyle changes is in the 1% range, 1 percentile of all people. According to all these studies. I mean, we've seen people who do it, they're on YouTube, or I've seen them in our practice. But I've also seen that same patient lose the weight and then a year or two later start to regain it back. The average weight loss for lifestyle interventions is about 5%.
Of body weight?
Yeah.
Okay.
300 pounds, 5% is 15 pounds. If they do it right, I mean, as good as the medical studies have supervised those patients, 50% of people are going to lose 5% or even less of their body weight. The 10% body weight loss is even less. It's like in the 30, 35% range. The 20% body weight loss is much lower, And literally, it's like 1% of people that can reach 30% body weight loss.
So is that because they're not adhering to the program, or is that just their body type?
No, these are
not...
patients who are actually doing it.
Okay. So their body just doesn't...
Yeah, the actual success rate is terrible with that. And everybody's down on themselves for that.
Uh-huh.
They're blaming themselves for that, for not being able to lose the weight.
Mm-hmm.
And they think that everybody else is out there losing it.
Mm-hmm.
And so the stigma comes in with them coming in, and what they say to me and their behavior is like, man, doctor, I'm so sorry. I am trying, I don't know what I'm doing wrong,
Right.
but I'm stuck. And you can tell they're blaming themselves.
Right.
They don't realize that if they were to lose more weight, they would be the overachievers or the outliers, you know?
So I guess here's my question is like, if let's say I'm in a calorie deficit and I'm exercising, and like I said, like per the BMI, I'm still overweight,
Yeah.
right? All of these studies that we talk about that say, well, obesity is linked to all of these chronic medical conditions. Is it the fact that I'm overweight that causes me all of those downstream consequences, or is it the lifestyle choices I'm making that make me overweight that give me all those chronic medical conditions? You know you understand the question?
Yeah.
Right?
Well,
Like
there's kind of two questions in there. So let's look at the first one. Like, let's say you actually did lose 30% of your body weight. You're at 210, down from 300, and what your medical status is then. And the second question really is, why did that patient develop obesity in the first place? I mean, that's a huge question. And so we'll come back to that one in just a second. So if you lose 30% of your body weight and you get stuck, you hit your plateau, whatever. I mean, first of all, it's amazing that you lost so much weight.
right.
But the question is, are you healthy enough?
Right, yeah.
And you're much healthier for sure. A lot of times we see the diabetes would go away at that level. Your blood pressure would get much better. I mean, it's hard to predict if it would get totally normal. The effect on your joints would get better, sleep apnea would get better. We think even your cancer risk would go down. I mean, that we're just theorizing based on the observation studies that we have. But you would still have some residual risk. You still have obesity, you're still above a healthy weight.
Right.
You would still have some residual risk.
Okay.
Some of that risk would be heart disease, just the whole spectrum of diseases that people would experience.
Right. Joint problems probably,
Yeah.
right? Yeah.
Yeah.
Okay.
So I'm still trying to optimize as much as possible. If I saw that patient, we were at 210 and their healthy body weight would be like if they were still above a healthy body weight, or they were even in a borderline body weight with ongoing medical complications, we'd still want to treat that patient.
Okay. Would they be a candidate for a drug then, a GLP-1 at that
Yeah.
point? Okay.
Yeah.
Got it.
And then the other danger zone is the weight regain. So you lose the weight, great. Trying to maintain it, that's even harder.
Trying to keep it
So
off.
what are you going to do for the next 30 years?
Yeah.
You're going to have to follow that same exact regimen to the T, and you may be able to maintain the weight, but the statistics show that you won't be able to.
So is that a question of, and this is one thing that I've always wondered, is that, like, are we obese because of lifestyle choices that we make? Are we obese because like our DNA dictates that this is how our body is going to be? Is it a combination of the two? Like, obviously the obesity rates now aren't what they were in the 1950s, right?
Yeah.
What's the main cause of it, I guess?
Yeah. I've been personally looking for the answer to this question. I go to my medical conferences, I read my educational stuff, and nobody's really talking about it. So I'm digging into some stuff that we're not really talking about much. There's some proponents out there talking about ultra-processed foods.
I've heard a lot about that.
Yeah.
From the current administration.
Yep. So they're pushing it, and they're also talking about food dyes and other additives. I can't remember the name of the cardiologist now, but there's a cardiologist doing some great work. I'll post this in the comments with some references. But he put out a paper, just an editorial, about the obesity rates in the 1960s compared to now. And the rates have just gone skyrocketed, steady incline. But actually, the nation's calorie intake has stayed the same.
Really?
And that's bothersome.
So here's another question.
So
Isn't that
where the heck is this all coming from if we're not eating more?
Well, isn't it just, it's thermodynamics, right? Like calories in, calories out. Like if I eat 2,000 calories and then I burn 2,000 calories, the math says that I shouldn't gain any weight, right?
That is the main theory. The main view on obesity and weight loss is thermodynamics. A lot of people talking about insulin resistance right now, and thermodynamics, the studies show that theory is better, and that the outcomes actually follow the thermodynamics better. But there's other stuff.
And go ahead, sorry.
Other stuff besides the calories, and it's more subtle. We're really only seeing it with the population curves of weight going up, even though the calories are staying the same. So each individual person, we do see the calorie theory working better. But the main theory right now in some of these researchers who are researching it is ultra-processed foods as that added layer. You don't have to increase calories. You don't have to, it's not about food cravings, it's not about anything else. It's just about that food causing weight gain independent of calories.
Yeah. And I also wonder, in these studies that they're doing, sometimes, when I was in college, I loved learning about studies and how they do studies and the errors in studies and how you got to tease those things out. And when I heard about the whole ultra-processed food thing linked to obesity, I thought, well, people who are overweight are probably going to be eating more processed foods, right? Because they're less conscious of what they're putting in their bodies, right? Like most healthy people who are conscious of what they're putting in their body, chicken and broccoli and right, that kind of thing. Whereas if I'm eating potato chips and Doritos all day, I'm probably not the type of person who would be more worried about that. So maybe I'm the type of person who would be more overweight. And that's the perspective that I'm looking at it from, is maybe there are studies, like the whole correlation causation thing, right? Like maybe there are studies that show that people who eat a lot of processed foods are more overweight, but maybe it's not the processed foods. Maybe it's just that processed foods are really calorie dense and they're salty, so we want to eat more, and then we want a sugary drink to wash it down. And now that we're doing that, now maybe that's because we're overweight, right? But I don't know. Does anybody know?
Well, the ultra-processed foods are definitely addictive. And they keep you coming back for more. I mean,
I have a hard time stopping a bag of potato chips.
The poor Pringles motto, the poor Pringles company, they made this motto that once you pop, you can't stop.
And it's true.
I mean, too bad for them they came up with that, because that is the key point with ultra-processed foods. The one reason you shouldn't eat them.
Right. And they're shelf stable, so you can keep them in the cabinet.
That was their whole tagline, right? Yeah. So I've read a couple books that I think are spot on, like Ultra-Processed People by Chris Van Toleken, Kevin Hall and Julia Ballou's
Blanket
about
on.
the food environment. I'm sorry to Kevin Holland for blanking on the name of the book, but those treatises really outline how ultra-processed foods alone, independent of calories, cause obesity.
Okay.
And the problem is, there's a lot of problems with where we are now. We don't have all the information to be able to make this determination.
Mm-hmm.
We don't know for sure. It's a really strong theory, but there's lots of studies. There's over 2,000 studies referenced in that book by Chris Van Toleken on ultra-processed food and the medical complications that come from it.
Mm.
It's insane.
Okay.
So if you want to be healthy, don't eat ultra-processed foods.
Mm-hmm.
If you can at all help it.
Yeah.
So if you're going to do any kind of diet, the whole food diet, even if irrespective of how many carbs, how much grams of fat, how many grams of protein, is one of the best approaches that I can think of to how to stay healthy.
Okay.
Okay.
We're doing good on time?
Yeah, I think so.
Okay.
We have a few more minutes, and then let's wrap it up.
I have more questions.
Okay.
One thing that I've struggled with is, like, I try very hard to exercise and I try very hard to eat healthy, and it's very difficult, and I'm not 100%, right? But we go to the gym every day. I meal prep every week, and I try very hard. And then, I have a family member who goes on a GLP-1 and just loses all the weight immediately, right? And I'm like, man, I wish I could just do that. You know what I mean? So what do you tell somebody like me who works really hard to be healthy, and then I feel like that's almost cheating, right? Like, well, that's not fair. The GLP-1.
Yeah.
Like, that's not fair. Like, it's really hard for me to eat healthy. Like, and you can ask my wife, like, we can't have it in the house because I'll get home from work and I'll just go and eat it until I feel sorry for myself. But so what do you tell somebody like me?
Well, you don't qualify for medication treatment with where you're at.
No, certainly
from
not.
what I can tell.
Certainly not. But I mean, I wouldn't mind going on it to get the food noise out of my brain.
Oh,
and that's something that I hadn't heard
Yeah.
until the whole GLP-1 thing came out. They talk a lot about food noise, right? And I'm like, oh, that's what that is. Like, okay. Because like I said, if I come home and it's in the cabinet, like I walk in the door, Dr. Moretti, and it's like a flip. It's like a switch flips in my head.
Yeah.
And I've gotten to the point where what I'll do is I'll drink a big glass of chocolate milk, and that's how I kind of get away from those cravings, and that actually works pretty well.
That's a lot of calories.
It is a lot of calories, I know, but it's better than the jar of cookies that were in the cabinet.
Yeah.
But so, anyways,
it's really hard not to be judgmental of someone else's habits.
Correct.
One,
it is
really.
very hard. Yeah. Yeah.
So I have treated people who have lost the weight and are starting to regain it.
Mm-hmm.
Because, like I referenced earlier, weight loss maintenance is actually harder than losing the weight in the first place.
Because you have to do it for the long term now.
No, it takes more work.
To maintain it, you think?
Yeah.
Okay.
Yeah. And that food noise just gets worse because there's this thing called the set point. Your body, people with obesity have this reset when they gain weight to this new weight. And so let's say they are at 300 pounds and they lose weight. The research shows that the set point doesn't really change. The book, The Hungry Brain, talks about this. When you lose the weight, your body senses this deficit, like, I'm starving by this much. Kick it in. And they're signaling you to bring that weight back up so that you can maintain your balance, your homeostasis.
Oh.
So
And I don't have that because I've never
that's
been
the
overweight.
food noise.
Okay.
You're constantly being signaled to bring your weight back up, to regain that weight.
Yeah, and it's funny because this is the other thing that I think I heard this on a podcast I was listening to. The guy said, he was like, for some people the food noise is like constant, right? Like it's always like, where am I going to get my next meal? What am I going to eat next?
Yep. Total preoccupation.
Total preoccupation, which for me, like I don't have that, right? So the other side of the coin is like, okay, well, like maybe people do need it more than me because that's not like, it's not always in my head, you know?
Yeah.
Kind of like addiction, right? Like some people can quit smoking cigarettes like that, and then other people like, they're like, I've tried for years and I just can't do it. And this is the conversation I was having with my wife is, like, you can't go inside somebody's head and figure out, like, is it a lack of willpower and a lack of discipline, or is it just that, like, they can't get it out of their head?
Yeah.
We'll never know,
Yeah.
right? But still, it's a really interesting question for me.
For all these haters out there for medications, I don't mind if you hate on it, but you don't know what's going on in someone else's life.
Exactly, and you don't know what's going on inside their
brain.
head. Exactly, right.
And what they're feeling inside. And personally, I don't either. But I ask when I see them, and if I feel like their life would be better with a medication, I would offer it.
Yeah.
And I'll tell you, 90% of people out there who don't have obesity are eating the junk.
But it's their body, you think it's their body
But
type?
they don't have to answer for it because nobody cares. They don't have obesity and they're not blaming them for it.
Right. I dated a girl like that who she ate, and it would bother me because she would eat horribly and she looked fine. And I would be like, look, like, you need to eat healthy and take care of yourself. And she's like, why? I look fine. And I'm like, it's not about how you look. Like, it's about what you're putting in your body.
And they don't get judged for it.
Exactly. Right.
But people with obesity get blamed for causing the obesity because, I mean, what else would cause it, right? Except for 70% of obesity is partially or determined by genetics, or at least you're predisposed.
Yeah, yeah.
And then you have the ultra-processed food that our environment is just laden with ultra-processed food.
Because it's profit-driven.
Yeah, and you almost, and we really can't get past it completely. So it's tough to judge someone with or without obesity on what their habits and lifestyle is. So I still have to make a medical decision based on the facts that I see with people. And
like you mentioned earlier, like the facts are that if they go on the medicine, their long-term outcomes improve.
Yeah.
Which we should want, and like, in my opinion, like yes, it is a question of like discipline and willpower to some extent, but then the other side of the coin is, should that really matter? Because at the end of the day, all we want is for a healthy society, right? There's so many benefits to that, whether it's how much I have to pay in my healthcare premiums, or, you know, like how long my wait times are to get into the emergency, like whatever, right? We all want a healthy society. So I guess the question is, well, how do we get there, you know? Yeah, and we really need to clean up our food policy. And we're going to be working on that at the Arizona Obesity Organization, working with the Department of Public Health, and as much as we can to change the marketing, change the education level about what people know about these foods and drinks and how bad they really are, because they drive so much disease. It's incredible. We could sit and talk for another hour. I could. I absolutely could. Yeah. But let's get back together again and keep chatting. I would love that. We could even do like an impromptu video. I would love that. Video chat. We can get on and continue the episode. Yeah, that would be great. I'll swing by Forte one of these days and chat with you. Yeah. Yeah. Drop in and see my wife. So. Okay. Thanks, Johnny. Yeah. Thank you so much. I appreciate it. Yeah. Absolutely. Thank you.